I actually recently made a post about a particular course that I had taken. It's a combatives course. And so there's a lot of grappling, a lot of rolling around. Basically, you're just dealing with violence. And so some people come for the violence and some people come for the little tidbits that come along with that. And they don't really want to participate in that. But it's hands-on type stuff. You're actually wearing headgear and in some cases gloves and things like that. I won't go into too much detail there, but I posted that and somebody had DM'd me online and it's like, oh man, that thing's coming around again and I'm going to miss this class again because I've been dealing with this shoulder injury. Oh. He goes, stupid me. This is not the first time. It's not even the second time.
Oh boy.
But I tried to come back too early, and he just kind of re-damaged it. And this is a guy like, I don't want to say advanced in age, but he's well over 40 and he's by his own admission, like, he's abused himself, and so I could tell they were
middle-aged.
Yeah, that's what they tell me. So I commiserated a little bit with him. We kind of had a couple of laughs and I'm like, hey dude, if there's something we can help you out with, let me know anything we can do to get you back on track. And it got me thinking, I was just kind of, again, commiserating and reaching out to the guy and talking through the things that a lot of people have gone through. A lot of people have, they're very committed to their fitness journey. They're being weekend warriors. They're doing things. They're on the jiu-jitsu mat. They're playing pickup basketball. They're falling off their mountain bikes. There are all these things, and it just puts a wrinkle right into the thing. Whatever the thing is for you, it puts a wrinkle in it. I've had that happen several times, and I've talked about it on the show before. My back is somewhat fragile. Like I have to be very careful about how I do things now. I just have to choose wisely. And there was a lot of frustration that came with that over time. And there's a huge learning process. And one of those learning processes that I got through, and this is one of the things I was chatting with this guy online about, was how to get through the medical process. Because once you're injured, you're like, okay, I am injured. Like there's an injury and there's being hurt, as you might hear it referred to. Like, am I injured? Like, do I have tears, cuts, breaks, avulsions, bulges, if you will, all that kind of herniations, if you will, like that? Or am I just hurt right now? Like I've got a contusion and, again, could be considered an injury depending on the degree, but how do I get through it? And how do I keep moving? Like, how do I keep doing stuff?
Yeah, because there's fear that comes along and hesitation, right? Because pain.
Yeah, that's a lot of it. But it's like, for me, the fear is not about the pain. Like I've dealt with the pain before. And again, that was one of the things I was discussing with this guy. This is a tough dude. Because it's not the pain. The thing that bothers me the most is the frustration about being pulled back from the thing that I was doing. That's not everybody though. Some people, as soon as they feel the pain, it's, oh my God, I
got to stop.
Yeah, there's all these things. But the process in going through the modern medical healthcare system now, when you've got some type of an injury, or you're at least just trying to be diagnosed, for what's going on. Like, why does my shoulder feel this way? Why does my knee feel this way? It's because it stopped you from doing whatever it is that you're doing, or you're just, again, you're having a little pain and that's uncomfortable and you want to get this fixed. That's okay. The modern medical system has really changed, I think, the way people approach pain and they approach their return to play for a lot of reasons. And, people can debate, all the reasons that are out there. That's not what we're going to do on the show today. What I wanted to talk about is what happens when your doctor tells you to stop lifting weights and working out. You go because you have one of these things, something's going on, and the first thing they tell you, like the cure is to stop working out. Or at least that's seemingly what the client hears or the patient hears. And so that's what we're hearing. So I think there's some things to talk about here to navigate this process, particularly if you're that person that's very unsure, or you're that other person that's like, yeah, there's got to be a workaround here, but I feel like I may be caught, like I'm only hearing this one opinion and I'm caught in this little system here of this is what this guy has to work with. This is what he's telling me. I'm not feeling really right about this advice. And I think we should talk about it. It's okay not to feel right about it. Like, to question it is fine. It's not that it's wrong. Maybe that's the right thing to do. But there are questions that can be asked, and there are things that I think that can be done in order to keep people on their path to staying healthy, staying fit. And just stopping doing activity is not necessarily the answer, and it can be very frustrating. So what do you do when your doctor says, stop lifting, stop working out, for whatever the reason you went in there for? And again, so I think we have to define some things. Like, what is it?
Exactly. So what is it that you're experiencing as far as why are you seeing that doctor? Is it shoulder? Is it knee? Is it hip? Is it foot? treat.
It's like orthopedic
Right.
stuff.
Mm-hmm.
So there's the orthopedic stuff of, a lot of people, if they're active, a lot of people listen to the show, they know what that is. Like they've had that ache or pain somewhere. But there's other things, right? There's like cardiovascular health,
Mm-hmm.
right? That's a little bit different.
Absolutely.
Those things can be a little bit tougher to diagnose without getting into maybe some more serious diagnostics. So you might approach that advice and or the return to play or
differently.
much
right?
differently.
Mm-hmm.
Yeah, much differently. So that's one thing. One of the other things that comes up is just like from like a metabolic perspective, a metabolic health perspective outside of the cardiovascular health.
Mm-hmm.
There are things that I mean, what's 75% of our nation right now is like pre-diabetic
Mm-hmm.
or diabetic. And that's just who knows.
Mm-hmm.
Like, and you get people that are like, well, maybe you should be taking it easy and not pushing yourself or whatever else. And then that turns into, well, then I shouldn't be doing anything. I'm going to go on some crazy diet. So there's like metabolic health issues as well. Am I leaving any out?
Oh, I can't think so.
Yeah.
That's what comes to my mind.
So talking about metabolic, cardiovascular, orthopedic health. I think a lot of this stuff, and this is how I started this, is the orthopedic stuff. And that's, I think, where we should focus our time, because when you start getting the cardiovascular risks and some of the other metabolic things, that is a little bit of a different conversation.
That's outside of our wheelhouse.
Yeah, way outside. Mm-hmm. Well, I wouldn't say way. I would just say it's outside of us being able to make some type of a call from our position, an our informed position, and or being able to work with a physician or a practitioner on the other end from the orthopedic perspective. Mm-hmm. Cardiovascular stuff just gets a little bit more in depth. It's not as visible. It's not as palpable. It's not as easily I don't want to say easily, not as readily diagnosed. Sometimes these things take time. Mm-hmm. So anyhow, going back to the orthopedic thing, there's the shoulder, there's the knee, there's the back, there's the hip, there's all this other stuff. And my doctors just told me, because I went in, like my shoulder was bothering me, and they tell me like, well, doctor said to just rest, don't do anything. It's so frustrating for me to hear, because that could actually be counterproductive to this person getting better. But I don't know, like we've had lots of people come in here and go through that. And so go through that process. And the first thing is like, okay, so let's talk about the visit. If we can get them ahead of this visit, mm-hmm. like that's very helpful. But what's the typical process that people go through? When
they have an injury, they usually go see their primary care physician. I think a lot of it depends on their insurance carrier. Do they have insurance? Yeah. If so, is it a PPO or is it an HMO? If it's an HMO, then you have to generally go through your GP, your general practitioner first. They see you. They'll make a call based on how you're presenting, signs, symptoms, and then perhaps there's a prescription of physical therapy or some type of oral anti-inflammatory or pain medication. And then you go along that route, and then you usually have a follow-up. And depending on how long this gets carried out, then you might finally get a referral to an orthopedic or a specialist of some sort. If you have a PPO type of insurance, then you can go and see a specialist on your own accord without having to go through a gatekeeper. And then again, depending on who you see, they'll do an evaluation, see what they might call indicate what the treatment protocol would be, whether that's some type of medication for pain management or physical therapy and whatnot. Sometimes the recommendation is you need to quit exercising. Mm-hmm. And that gets frustrating for the client, but then also for the coach that's working with the client. Because if a physician's saying you need to stop working out, there's so much more that can be done with that individual that's not necessarily utilizing that body part that is injured or they're experiencing some kind of discomfort in.
Yeah, a couple of things that came up there for me are who are you seeing, mm-hmm. right? What are you seeing them for? So if you're going to your GP for an orthopedic issue, that's not an issue that they're likely seeing very often. I'm not saying a mm-hmm. GP can't be helpful in diagnosing an orthopedic issue. Mm-hmm. Again, shoulder, knee, back, whatever. I'm just saying they don't see those on a regular basis, particularly not now today in today's society. Like they may be getting that stuff in there, but it's more of the metabolic health issues that they're seeing on a regular basis, mm-hmm. right? So, if you're looking for a very specific diagnosis, maybe the general practitioner or primary care physician isn't the right person to be doing that for you. And maybe you don't have a choice, going back to the HMO versus PPO thing. So you're going to go if you're in that route, I think that the second part of this is like, who is going to see that practitioner? So if we keep this in the realm of the person that's active and works out and is, generally taking good care of themselves, or at least attempting to, you need to arm yourself with some information going in and be prepared to ask some questions. Don't just go in there looking for the answer to your problem, expecting the answer to your problem to be given to you, whether you're in the HMO or PPO thing. Go get yourself educated. And that doesn't mean get on the Google and self-diagnose yourself. That's very frustrating it's going to end up being frustrating for you, because if you decide you are labral tear, or you are ACL sprain or something like that, or tear, whatever it happens to be, that's very hard to get your mindset out of, and you're going to miss things along the way, especially if you couldn't be any more wrong. So I think it's a little bit of who's going into it and how are they going into that situation. So on the flip side of it, let's go back to the who are you seeing. So if you have options to see people that are more skilled in looking at the orthopedic side of things, that's who you should choose first, right? Save yourself some time, right? Save yourself some energy and maybe even a little frustration, and go see people. Who are those people? Well, for some people in line, that's going to be a physical therapist. That's on their list of who they can see or that's approved to see. Not a bad thing, right? They're going to be way more in the realm of taking care of people with orthopedic conditions than other skilled practitioners. I was going to say,
yeah. Physical therapists, I think they also have specialties, right?
1,000%. I mean, you
find somebody who's skilled in orthopedic evaluations.
A lot of times they'll be even housed or in facilities with other people that do even more specialized things. You've got a chiropractor that may be in that same building, or work in that same practice or near, or works in combination with. So you're going for a low back thing. You go to see your physical therapist, and your physical therapist sees what that might be, and then can immediately talk to, say, a chiropractor who deals obviously very, very specifically with the spine and pelvis and things like that. To maybe they can work together, or it's just a referral. You're probably going to get a little bit of a different story from those people than you get from, again, your GP or your general practitioner. So that's one thing. There's again, going back to the orthopedics, if you can see somebody that deals directly with orthopedics, one of the things you might want to do is check out who deals with your specific thing, right? I know around here we have people that we consider the knee jocks, or the shoulder jocks, or the
wrist and elbow.
Yeah, we have a couple podiatrists that we send people that are you got a foot issue, go see this dude. And it's not that the other orthos that deal with the shoulders and the knees or whatever can't deal with that. It's just this is what they do. And, that's where medicine has gone, particularly in the Western medicine. It's gotten very, very specialized. So while it's gotten a little bit out of control in terms of costs and quality of care sometimes, or whatever else, what it has done is got very specialized, and you got some really sharp people out there that are doing some really sharp things. So know who you're going to see. Do some research. This is on you. Just because you're paying your insurance,
you have to be your own self-advocate. Right?
Yeah. You got to get into the website or into the, the catalog that they send you in the mail that costs way too much friggin' money or whatever. That's where your insurance money's going. To pay for all the paper that they end up sending you in the mail. Go through your catalog, see what's up, and don't be afraid to call a couple of different people and get a couple of different opinions. Okay, so your copay is $25. It costs you $50 to see, 2 different physicians, or if it's 50, it's $100. I want to know I'm on the right.
It's an investment.
If you've invested this much in your health at this point, paying an extra $100 on top of the premium that you've already spent shouldn't really be that big a deal to you. Again, everybody's finances are a little bit different. I don't, who am I to say, but I think maybe going that route, and certainly if you've got a referral from somebody or whatever that, puts you makes you feel more confident about the decision you made and the person that you have or that you've gone to see, that's your choice. So make a wise decision to see the person that you think can help you the best. You might not choose right. That's okay, but you do have choices there. If you're not that person that has those choices, you're in a very specific system where you have to see the GP first and then get a referral out. I think it's very important, more important, that you educate yourself ahead of time and be in a position to have a conversation and not be afraid to ask questions about what's going on. A lot of times you alluded to this when people go in, it's like, okay, well, we think it's this, whatever it is, like it's a shoulder thing. Well, it could be a rotator sprain, right? That is nearly impossible to diagnose just by sitting on a table and having
without getting hands-on,
without
right?
getting and going through a thorough assessment. So if you've gone to see your GP and you haven't had a hands-on, thorough orthopedic assessment, you may not know what that is. Google that shit. Look at it on YouTube. Like if you've got a shoulder problem and you go in to see your GP and they're not putting their hands on you, they're probably not putting their hands on you because they don't know how. Right? They also might not be putting their hands on you because their hands are, theoretically cuffed. They don't have the time to do it or whatever else. But if they're giving you a diagnosis and they're giving you medical advice based on that low level of examination, you should be asking some questions.
Absolutely.
You should be asking some questions. If all you're walking out of there with is a script for a bottle of anti-inflammatories or painkillers, that's a problem.
That's temporary.
That's a problem. And again, that doesn't mean your doctor's wrong for doing that. I'm not saying doctors suck or doctors are wrong. I'm just saying that should be a red flag for you. Like if you really want to get better, if you want to improve this and not just put a Band-Aid on it, that should be a problem for you. I would be asking, what is the diagnosis, the specific diagnosis? What is the prognosis? That is, what should I expect from this over time? And what is the specific treatment that I can be proactive with in order to get better? A drug prescription is not a proactive treatment in my mind. What that is a temporary solution to masking the pain or putting a Band-Aid on it. I don't know how you feel about that, but those are like my frustrations. Like you have to ask those questions. If you don't know how to ask them, then what you've walked out of there with is a bag of drugs. There should be a doctor or a physician or a practitioner should be able to tell you what they reasonably think this is. They don't have to be perfect and right about it, right? Or they should say, they might tell you, I think it could be one of these things. We will not know till we run further diagnostic testing, which could include, X-ray, MRI, ultrasound, things like that. Okay, what's the next step in understanding this deeper? Or if you've gone to see your GP, it could be these things, and your next steps would be to maybe get an ultrasound or whatever, but also we're going to start this physical therapy process because it appears to be soft tissue, and at the very least, we've got you in the process to get better. So hopefully people listening are picking this up, and that is, there should be next steps outside of the medication and outside of being handed a piece of paper that says, do these exercises. Because if again, thorough assessment, if I haven't had that thorough assessment, then what are you giving me drugs for? If you haven't done a thorough assessment, then what are you giving me this piece of paper with all these exercises for? Like you're just kind of throwing something at the wall and
hoping it sticks.
Seeing what sticks.
Yeah.
So I kind of ran on there for a little bit because it frustrates me and it makes my blood boil a little bit that the extra time isn't taken to walk people through this process.
To help them understand what's happening with their body.
And how to fix it. Like, and how to make it better. And again, like, you might need surgery. Like, there are things that require that, but that shouldn't, if it can be avoided, let's avoid it. What are the things we can do? So again, like, what can I be doing to be proactive? What is the specific diagnosis here? What is this problem? If your doctor or practitioner cannot tell you what it is, you should ask the next question. How do we find out?
Yes.
How do we find out? Like, what do we do? Who do I see? What machine do I climb inside? Right? What machine gets put on top of me so that they can maybe see inside my body to know what's going on there, with the understanding that even the best machines in the world can't show you everything. What is the next step here to understanding this at a deeper level? Because the more you understand it, the more, if we understand what it is, then we can manage and treat it more specifically. Just managing pain is not managing the problem.
The situation.
It's not managing the situation.
Not getting down to the root cause. Exactly.
Yeah, so it's weird. You're sitting there in the GP. Again, this was back to the person who doesn't have those choices. You go back to you're standing there in front of your GP and they're like, oh, we're going to give you some stuff. Okay, what are the next steps? Who do I go see next? Where are you sending me? Literally, just be direct. Well, okay, ask for physical therapy. Again, There's pros and cons with all different types of treatments, but ask for some physical therapy. Get in front of the person that knows more than this GP about the specific thing that you're doing.
You can always ask to see another doctor in your, your network. So there's that option as well.
Yeah, and that might not be very fruitful. You might end up getting the same answers or the same treatment, but you have to keep knocking on that door. I tell people all the time, like, you got sometimes they're just going to have to jump up and down and scream, and get that, and to get that attention. So who are you talking to? Who is it? Who are you and where are you coming from? Being able to explain your exercise history and give a good detail to whoever you're working with about what your history is, what was the mechanism of injury, if you know, so that they can help get a little closer to that diagnosis or help put you in front of the next right person if they're there. Advocate for yourself. I do not want to take drugs, right? How do I avoid taking the medication?
Yep, or I don't want to take an injection. There's
that. Yeah, you want to talk about that? Your own experience with that?
Well, I've had a couple of experiences, but as far as clients, I've had clients where they've had shoulder pain and they have gone to see their physician and their physician has recommended a steroid injection. And sometimes those clients don't know the questions to ask as far as, okay, so if I take this steroid injection, what's it going to do? How long is that going to last? Because they're just going for the injection. They're not necessarily talking about strengthening the shoulder again so that it has better mechanics for movement. What's the longevity of this treatment plan? And what are the what are the outcomes or the consequences for taking this?
There always are.
So ask those questions because that's not always the right route for you to go, especially if you're very physically active.
Yeah, for sure. Like, it was interesting. I was at a 4-day event. I was in some shoes and on some terrain that I'm not usually on. My back got really tight, really sore. And I have some nerve issues and it's getting that numbness back and that aching back. And it was really bothering me. And occasionally I know like this is an inflammation issue. And so I got to knock that down. And I have some basic, big ibuprofen. I do not take medication, but when it gets to the point where I'm debilitated, I can't work, I can't move, then I can't sleep, like I take the pill, right? And so it's ibuprofen, it's an anti-inflammatory.
Take the life jacket.
Take the life jacket, right? So over the course of 2 weeks was really bothering me. I took the life jacket 2 times. At the same time, like making sure I'm staying mobile. I'm doing the stretches that I know are helpful for me to keep things moving. Trying to get a little workouts in without overstepping and setting myself back. Making sure I'm not sitting too much in the chairs that I know aggravate the thing. Those are all proactive things that I'm gonna be doing. But that medication is something that I take. So it was interesting when I got the 2 times, I did it 2 days in a row because I'm like, I got to knock this down because it's not going away, right? No matter what I'm trying here. So I got to knock this down. And so I worked out. I got a little workout in and man, did I feel like shit working out on it. And I was aggravated by it. I was happy to be working out because I've kind of been avoiding things a little bit. I was like, just let me rest this a little bit. I don't want to do anything that's going to aggravate it anymore. But I was more mentally aggravated by the shit workout I was getting because my body was different. Like I put an anti-inflammatory in me. The pump that I was getting felt weird, right? Like the muscle burning that I was getting felt weird. I felt weak. I was getting fatigued very quickly. Like the drug's doing its job. Like it's doing what it was supposed to be doing. But that's not what I want to be doing longer term. And by the way, yes, I felt better
right away,
almost immediately, right? And since I've been feeling great. I knocked it down a little bit, was able to get back to my thing. There's nothing that can fix me from a drug perspective, and from a surgical perspective, it would likely just make it worse or give me a temporary problem or a temporary fix. So I just have to manage my situation, and I don't want to manage it through drugs. However, I understand on occasion that could be helpful for me, and in this case it was. But my point to that is like being on drugs and trying to perform, it doesn't generally mix very well. It may work for a while. You may be like, this is great. I took the cortisone injection. My shoulder feels fantastic. I can go overhead again. I'm snatching, I'm pushing, I'm pressing, I'm doing all this stuff overhead until it wears off, right? And you've done nothing to fix the problem. Like you mentioned mechanics or there's some orthopedic stuff in there that needs like physically needs repair or could be checked or challenged or maybe you shouldn't be doing those things anymore. We need to find workarounds.
And I was going to say, because you've had that injection or you've taken those drugs to make you feel better, you could be doing worse for yourself by continuing to go overhead and doing those exercises because it's masking the pain.
Just beating the shit out of yourself, right? You're basically just ruining it worse than it was already ruined before you started. So there are time and a place. Like, and that's I just gave you the case in point. There's a time and place for this. However, again, going in and being told that you need to stop working out, I don't think that's a great answer either. So what are some things that you can ask, right, around like, well, what?
Be specific, right? So if your doctor says, yes, exactly, please tell me what can I or can I not do? So if we're talking about an upper extremity injury, let's say shoulder, so can I still squat? Can I go for a run? Can I go hiking, biking? Because maybe biking you can't do because you have to hold yourself upright on your bike or get down low if you're on a road bike, depending on what the situation is. But you know what? Ask questions. See if they make sense. If it doesn't make sense as far as what the recommendation is, ask more questions.
Yeah, you got to use your gut here. And I think it's important to note that you're asking questions that the person actually might not have answers to because that may not be totally informed. So, and remember, they deal with the general public all day long. Going back to who's asking, you're the advanced exerciser, right? That's not who your general practitioner sees all day long. Very different, like if you went to that very specific orthopedic surgeon or other practitioner, chiropractor, physical therapist, somebody else in like the somatic world, something like that. It was like, no, we deal with you guys all the time. Like, so here are some very specific do's and don'ts. And likely that is being very proactive around gaining mobility or functionality within the shoulder while getting some, trying to reduce that inflammation. They may even start to talk to you about your nutrition and things you can do and all that kind of stuff, which is going to be way more than you're going to get from the GP. So ask who you're asking. You should expect a higher level of competency, the more specialized you get. And again, that doesn't make them right because they have, or that they're going to have all the right answers because they have these acronyms behind their names and they specialize in this and they've got fellowships here and all this other stuff. But you should expect a higher level of competency, and I think that's important as you go through this process. That let's be fair about the general practitioner and what they might be giving you. That might be what they know, right? They're going to give you what they know. It's okay to ask these questions, and it's okay for them not to have answers, the right answers for you. That doesn't mean they're stupid.
No.
Doesn't mean they don't know what they're talking about. It just means now you're outside of their wheelhouse. That is where we're trying to get you to. Okay, not in your wheelhouse. So why are you giving me drugs? Because they have the ability to do that, and that is the one thing within their repertoire, within the silo that they can practice in to help you with your problem. And that is what the doctor is trying to do, right? To help you get better with or somehow solve your problem. And sometimes for them, they may feel like drugs is the only option because that's all they know, right? It's what's easiest accessible to them. They know your insurance is going to pay for it. Let's get you out of pain. There's nothing wrong with that. However, it can be detrimental to the long term if we're not, again, going down this path of what is the long-term solution. So I think expecting and having that mindset of expecting a higher level competency from those specialists is a good thing. That also means you need to go on somewhat informed about what it is, who it is that you're dealing with, and again, what it is exactly that you want from them. So just scheduling an appointment like, oh, I'm getting with the best neck guy at Stanford. Okay, well, what does that mean? What do you want out of this appointment? What do you want out of this thing? If you're going to see a surgeon, guess what they do really well? Guess what's in their repertoire?
Cut.
Yeah, they like to cut things. And they're fucking good at it, right? Most of the time, they're usually really good at it. But if you go to an orthopedic surgeon, for a knee thing, well, expect that surgery is going to be an option for you. if you don't want surgery to be an option, maybe you don't go that route. Maybe you go, but that might not be in the cards for you. Maybe you do need surgery. I'm just saying, but maybe you need to pick somebody else that specializes in non-surgical or invasive approaches.
And they're out there.
They are out there. Yeah, they can be a little tougher to find, and they're certainly not mainstream, if you will, depending on the communities that you live in and kind of where you're dealing with from a cultural perspective. And I mean that from an outside get active culture. Generally these types of doctors, these type of physicians or practitioners gravitate towards the areas where people want.
Physicalness is part of the culture. It's a lifestyle.
Yeah, so you might have to travel a little bit. You might have to get out of your comfort zone or make a little trip, but these people exist. Yeah. And so if you want a non-invasive approach, or you're looking for a non-invasive approach, well, then you're going to have to do the work to find somebody or find people that deal with that. And they do exist. And again, once you get to there, I would say the level of competency that you should expect from that person should be even that much higher, because and also that they're very, very honest, and you should be able to ask them, well, I don't want surgery, but what are your thoughts on this? And if they tell you that no, you don't ever have to have surgery, that's a red flag. It's the same as just getting drugs out of the gate, because maybe surgery is necessary or could really help you achieve that ultimate result. So again, this is likely not the doctor, though, or the physician or the practitioner that's going to tell you to stop moving, to stop doing things. This would be the person, if they're more on this, again, non-invasive, let's just say, what's the word I'm looking for? Non-conventional, maybe more a way of looking at it, a non-conventional way. They're going to be able to, they're going to talk to you about exercise. They're going to talk to you about all the different modalities that could help you get to where, get the direction. Back to
functionality.
Back to where you need to go.
Guess what the expectation will be? You're going to have to put in some work.
Yeah. That's the mindset you have to be in. If you don't want to do drugs or get cut, guess what? This is going to be work for you. So I think there's a mindset piece to that. So if you don't want to be told not to work out, then you need to prepare yourself for, I would assume, the worst. I'm going to be told I can't work out anymore. So what are the questions that I need to ask in order to, get past that? And, or, what are the things that I can do? How might I need to be modifying things? The other part of that mindset is be prepared for that answer. It might not be awesome. You can't CrossFit anymore. No, you can't ride your bike right now. And that's why we encourage people to be well-rounded, right? And when you're out there trying to be fit for action, you're going to get hurt. You're on the jiu-jitsu mat, again, whether it's basketball or, your trail running.
It's inherent risk,
yeah. It's going to happen. So keep yourself well-rounded. So when faced with adversity, you have something to go to. Or keep the mindset of, well, maybe it's time to explore something a little bit different. So when doctor says don't work out anymore, take a deep breath and ask, what does that actually mean? One of the things that always bothered me is if somebody goes in and, they have a back problem or a knee problem, and it still happens. Okay, you can't squat anymore. What the fuck are you even talking about, man? I squat every day. I sit down on the shitter. I get in and out of my car. I sit down at the dinner table. Those are all squats. I think what they may be trying to say is maybe don't do any barbell,
heavy squats.
Back squats right now. But at the same time, if they don't have any idea what your fitness level is or what your history is or whatever, that might not be solid advice. Maybe it is, maybe it isn't. You might be talking to the wrong person. If somebody tells you that, that's a red flag. You shouldn't squat anymore. Or you just have to stop doing this activity altogether. If they tell you that, the follow-up question should be, okay, smart guy, what's the workaround? What can I do? And they should be suggesting alternatives and or an alternative person to talk to about getting the right program for you. You as an individual are responsible for getting the right answers for yourself. Depending on somebody else or depending on another person, another man to figure this all out for you. When I mean that another man, I mean another human. Yeah. A mankind to give you all the right answers and make it better for you is ridiculous. And it is the reason we're in the situation we're in, I think, as a globe, but particularly here in the United States as a nation with our health and wellness, is we're expecting somebody else to take care of it for us, to give us the answer and do it as quickly and as easily and as painless as possible in the form of a pill, a shot, or just a hug. That's not reality. Like it puts Band-Aids on problems. Well, actually, it is reality. And the reality is it's not making us any better. It's making us sicker, fatter, and more unhealthy. So if the doctor tells you like you need to stop lifting weights or stop working out, we've given you some things to ask. And this isn't to be inflammatory. No pun intended. And tell you to go pick a fight with your doctor. It's hopefully to put you in a place as you're moving forward. And again, I started this with like us old dudes. We have a lot of this stuff going on now, and we have to find workarounds. And I don't want to be told I can't do something as much as the next person. Like, I also understand that when I'm told I shouldn't do something, again, it's like just because you can doesn't mean you should. Just because I'm told I shouldn't do something doesn't mean I can't do something similar or even that thing. May need to be some experimentation and some education that comes along with that, figuring out what that is for me. And that's up to you to figure it out. I mean, a lot of information out there. But if you're looking for assistance from like a practitioner or a physician, or again, how we started this, a doctor, understand that is not the last stop. There are lots of stops and there are lots of things along the way to finding the solution for you. We work with a lot of people here that are solution finders, whether that's physical therapists, chiropractors, massage therapists, acupuncturists, nutritionists, gut docs, on all the things on the orthopedic side, cardiovascular, metabolic health people that are really involved with that, the longevity folks when we're talking about, hormones. And things like that. There are so many different stops along the way if you allow yourself to be sucked into that silo and you stay there, well, then that's kind of on you. Yes, these things can cost money. No, they're not always covered by your insurance. But I think for the people that really do, care about their healthcare, there's a solution out there. You can find workarounds. And that's what we're talking about doing, is find the workaround to the problem. Don't accept, I have to quit my lifestyle because I have this thing. No, I have this thing. How do I adjust my lifestyle to the thing in order to get better so that I can continue living a healthy, quality, and vibrant life?
Great.